Hi, I'm Megha Kumar, and I've spent the last 15 years working at the nexus of medical technologies and global health in various capacities. Currently, I'm the director of strategy for Medtronic's cranial and spinal technology business and continue to serve on the board of Maziwa Breastfeeding, a Kenyan-based organization developing breast pumps and breastfeeding education designed for low and middle income country contexts. For my leadership project, I wanted to bring together the business and public health sides of my own background to amplify the impact of medical technologies for working women, especially mothers. In Kenya, there is a tension between historically high exclusive breastfeeding rates and increasing economic mobility for women as more and more enter the workforce. These two highly positive behaviors for women are at odds with the realities of the workforce in Kenya. Continued breastfeeding as women return to work is a challenge in a country where the majority of women don't work in the formal sector and don't have formal feeding or leave policies and face a real practical challenge when returning to work in a country where breast pumps are not very feasible or common, particularly among the low income populations. For my leadership project, I supported Maziwa in honing in on how the feeding and working challenges look different and could be supported differently for low income women in particular. To bring together my business and public health backgrounds, I worked with ongoing Maziwa research efforts to amplify the significance of the findings and help map the implications to the correct audiences and business decisions. The research was done this year by providing 118 lower income urban and peri-urban new mothers with Maziwa's WEMA portable breast pump free of cost and follow up on their experience after 6 months. One main question we were seeking to better understand was whether pumps would be culturally acceptable in this population, for which pumps are not commonly used and for whom electric breast pumps are not frequently affordable. The results showed largely positive experiences with both the pump and cultural acceptance, but uncovered an even stronger finding in women's self-reported improvement in being able to manage household, feeding, and work-related duties with a pump compared to without the pump. From a dissemination and implications perspective, this particular result opened a new line of exploration between Maziwa, myself, and another Kenyan-based feminist economist. She sees this as a potentially new lever to explore in the equation of how women's unpaid care and how a technology like a pump can lighten the load or increase the capacity at a time when a new mother's care load goes up exponentially. Lots more on the publication and research front to explore here, but our belief is that this is still an underexplored area and worth a preliminary publication to get the conversation started. From a business model perspective, this research has opened up the practical viability of a rental model or a financing option to reach lower income women. The current price point of the pump would be out of their budget, but the women in the study expressed a willingness to pay for a monthly rental price that, over 6 to 9 months, would still be less than the price of buying the pump outright. This potentially opens up a whole new market for Maziwa, but will require greater work in setting up the operations for a rental model, accounting for motor returns, defaults, refurbishments if necessary, and a central rental management system. From a policy perspective, this research supports ongoing, well documented evidence that women's ability to continue exclusively breastfeeding at the mark coinciding with returning to work is challenging in this loosely enforced feeding and maternity leave policy environment. Though we wouldn't directly publish in this area, we're working with advocacy organizations to add our research to their growing body of evidence. Finally, we're looking to use mothers' self-reported improvements in being able to return to work and feed for longer to quantify women's economic productivity increases and women and babies' positive health benefits. Though difficult without a counterfactual, this mapping has helped initiate a conversation with a UK-based researcher who is working with us on the best way to appropriately shape these findings to reach both a broader scientific audience and appeal to a broader donor audience for whom Maziwa is highly dependent on. To me, this project really hit close to home and helped me tap into my authenticity as a leader and as a working mother who struggled with breastfeeding, loathed my pump, but was so appreciative of the benefits allowed me and my baby to experience. I recognize that my feeding equation comes from a place of great privilege, but it looks very different for low-income women in other parts of the world who are all still unified by the birthing and feeding need. This helped me explore more inclusive formats for supporting different kinds of working mothers and also helped me bring my day-to-day strategy hat to a cause that I think could have a huge impact on women, not just in Kenya, but in other countries who may face similar infrastructure challenges and and may continue to make motherhood just a bit easier for all of us. Thank you.